Welcome, my dears. Welcome, my dears, back into our own PowerPoints. And we will work now on the PowerPoints to the extension or the things which we've been working upon. And also here, I will add something here about the decision-making steps. Decision-making steps before we start our topic, which is the decision-making steps. Our topic now is called decision-making steps, decision-making steps. And we'll see that we have to start with some ideas and go from there into another ideas and so on. Decision-making steps. Let us share the screen first. Then go to the decision-making steps, our own topic. Here it is. Then double share on the topic. Here we go. It's a little bit late, but it's okay, no problem. Decision-making steps we all practice in our own life. We practice decision-making steps in our own life. Usually we start the decision-making steps by analyzing the problems, analyzing the problem. We start with analyzing the problem. And we go into the second point, which is in that point, I have to analyze the problem was very specified to analyze the problem. Second thing is I have to know the alternatives, each alternate from the alternatives which I have to be aware of the alternatives which we have for the decision making, We have to okay, finally, we got the share here. We are shared here right now. Finally, we are shared. So in any decision-making steps, we have, first of all, we go into the identifying the problem. Identifying the problem means try to recognize the problem, know what are the reasons for this problem to happen. And this is the first point. So we have to analyze the problem. This is the first point in the decision-making steps. First point is analyzing the problem. Okay, let's see how this works. We go like this. Here we go. Okay. Here we are. Okay. I can see here we start right now. Sorry about this small late. First of all, that we have in the decision-making steps in healthcare, we have to analyze the problem and know what are the components of the problem and what leads to this problem. So seek your patient's participation first, help your patients explore and compare treatment options. See now. So you help him in the treatment options, centers assess each one of these options, and then you will choose a decision. Then after that, you will try to see what this decision is right or wrong. So these are the steps of the first of all is identify the problem. And identifying the problem, you should know exactly what the problem is. You don't just like, as example, knowing the problem is knowing the cause which happened, which affected what's the results in the symptoms now. As example, if someone is having a headache, it's not a matter that I will give him Tylenol because the Tylenol will affect the headache and a painkiller. No. The point is, I just want to know why this headache off. Why did he get this headache? So as example, there might be alternates. So I will search for the alternates. As example, the first alternate is that I'm exposed to the sun, to walk in the sun for a long time. This is the first point. Second point, as example, that I have not eaten very well from yesterday. I didn't eat any food. This is also another point that leads into the problem. Third point, I might also don't have, as example, I don't have I walk in the sun too much. Fourth, it might be for organic reason. Five, it might be because of my vision. I cannot see, I'm seeing blurring, this causes me headache. So I have to look for the alternates. So the first step is to identify the problem, not the symptoms of the problem. So not the headache, but what caused the headache is the problem. Second thing, alternates evaluation. Each one of these alternates, I have to evaluate it and see which one of them. As example, did I eat well? Yes, I ate well. So this is not a reason. Did I work in the sun too much? Probably yes, because this is the only reason, because I walk in the sun too much yesterday, and so on. Third thing, find a solution. To find a solution means try to find out one of these alternates is the one who's working or no. Then after this, implement it. Implemented means I will put devise a plan. I will put the implementation here right now and say to myself that, yes, because I walk in the sun, so I will not walk today in the sun. And I will check out and see if there is still any headache or no. After I see if there is still any headache or no. The fifth step is to follow up and evaluation. Now I rest very well and have a good rest, and at the same time I didn't walk in the sun, and I'll just check out if the headache still there or no. In that case, just to see. So here are the steps of the decision-making process. Here are the steps of the decision-making process. The first step is identify the decision or check out what is the problem. Second step is to gather information about the problems and the reasons and the causes of the problem. Third, evaluate and select the alternate. Fourth, take an action. So I will say to myself, which one of them? As example, let's say here now, identify the decision again. Here, I will identify the decision means the problem. Identify the problem, the reason why there is a problem needed decision. As example, I have headache, so identify the reason for the headache. Secondly, check out for the alternates. What are the reasons to cause the headache? Maybe I walk in the sun. Maybe I'm exposed to stress. Maybe I didn't sleep very well. Maybe I didn't eat yesterday very well. Maybe also I have organic something's wrong with me in my system and biological system, and so on. Third, evaluate and select. Each alternate of those, I will study and see. Did I walk in the sun yesterday? Yes or no? Yes, I walked in the sun yesterday. Did I walk too much in the sun? Yes, I walked too much in the sun. Okay, this might be the reason. Hungry? No, I'm not hungry. I was eating very well. I slept very well. Yes, I slept very well. Organic reasons, diabetes, blood pressure. No, I took my medication and I did a test, and everything is fine. So I think now that the reason is walking in the sun, that I walk too much in the sun. Right. Now I will go to take an action. In taking an action, I will say, okay, today I will not expose myself and walk too much in the sun and in the hot, and I will check out, still I will have the headache or no. Still I will have the headache or no. Then the fifth step is monitor outcomes, check out. So if I found myself that I'm okay, that means that the sun or the reason for the headache which I have, then I will make a follow-up and evaluation as well. So I'll make sure again that I don't walk in the sun and so on. That is the decision-making steps. It's in healthcare, same steps like the steps in all other topics. First of all, again, is identifying the problem. Second step is to search for alternates. Third step is to evaluate the alternates. The fourth step is to choose one alternate from the other alternatives. Fifth step is to implement the chosen alternate. Then after that, feedback and control. These are the steps for the communication process. And actually, in the websites, you will find a lot about the decision-making process. You will find a lot of graphs and articles, including the decision-making steps. Discuss, this is our question now, the decision-making steps in health care system as an PSW. Give an example of decision making with your client. So just give me an example of a decision making with your client. Please look for the decision making steps like here, or you can search it on the website and go for answering this question before we move into the communication model or the second part of this lecture. So discuss the decision model making steps in healthcare system as an PSW. Give an example of decision making with your client. I'll stop here like around a few minutes to get your answer, guys. Now we'll go to the second part, which is the communication system. We'll go to the second part, which is the communication system or communication in healthcare system. So the communication model, like you know, it consists of the following: the source and the sender. So the sender and the receiver. We have a sender and we have a receiver. And we have decode, encode, and decode. One person will encode and the other person will decode. We have the message and we have the channel which the message will go through. We'll also get a feedback after this communication happen. So the communication with your client is very important. As a PSW, you know how to communicate, means how to reach the client with what you want to deliver to him from information or data. And you want to make sure that the client understands what you told him in the same way, with the same efficiency that you tended to send it to that client. So you make sure that he understands it on the same way you mean it, and you make sure that he did not understand it in a crooked or another way or wrong way. This is the meaning of you make sure from the feedback as well. So communication is very important with the clients, especially as a personal support worker. You are dealing with clients who are patients, having illness, having mental disabilities, having accessibilities, having problems. So in all the cases you will deal with these clients, you have to make sure that you deliver the information as it's supposed to be, and that you receive from them a feedback as well. Okay, so we have types of communication. Like you guys know this, we always talk about it, types of communication, and everywhere here in Canada, in every courses and every classes, you will find this topic, types of communication is always there. So we have non-verbal communication and we have verbal communication. We have visual communication and we have written communication. So we have non-verbal and verbal communication. Non-verbal communication or the non-verbal communication refers to any forms of communication that's not transmitted through spoken words, gestures, moving with the whatever you would just signal with your hand, signal with your neck, a signal with your head as example, whatever was, it is non-verbal. But the non-verbal means is not spoken communication. It's not a kind that is spoken communication. Visual communication, it means that you communicate with the person in a format that can be read or viewed. So visual, he can see it. Like you text someone, you will see the text. We have non-verbal communication, we have verbal communication. The verbal communication we all doing, like what I'm doing right now, I'm just talking. This is verbal communication. So talking is a verbal communication. This is any form of communication that occurs through spoken word. This is the verbal communication. Written communication. Written communication involves the use of words, sentences, and paragraphs in order to communicate. This is the written communication. We have also the touch. Touch is very important, especially for this PSW's work. But one thing you must know is that you have to take the permission before you touch someone. You have to take his permission. Touch is warmth, comfort, and is affection. Also, it's kind of trust and reassurance. And it's kind of passionate with the others when you touch someone, or this is means that you are, or like as example, put my hand on the shoulder, and this means a kind of giving kind of trust and giving kind of relaxation for this person. So it shows also that to make the other person is not feeling lonely. So your touch should be gentle as PSW, not hurried or rushed, and should be restricted to public areas of the body, such as the hands or the shoulders. So when you touch someone, touch him in his hand or on the shoulders. It is good rule to ask permission. Of course, for the touch, like I told you, you have to ask for a permission. Here I will go back to the word communication, and I said we have two. Communication means transformation of information from one part, which is the sender, to another part, who is the receiver of the information. So this is the meaning of the communication. Silence. Silence sometimes is a mean of communication as well. The use of silence can convey messages of acceptance or rejections or fear or the need for quiet and time to think. A support worker, you may find it difficult to accept silence when you want to comfort your client. So sometimes if you want to talk to the client and he's not responding to you, that will make you feel worried, like you will be worried and you will think too much. Why he is not responding to me? Or maybe he's angry, maybe he doesn't, maybe, and you'll start to ask yourself sometimes, do you need to say anything? Just being there shows that you care. So from a time to time, you can ask your client, are you okay? Do you need to ask me anything? Do you need help? So just even one communicate from one side, communication, it will be better than there is no communication at all. And since silence can give you and others time to organize thoughts and choose words, it's also useful when the client is making difficult decisions because he might be thinking. So keep for a little bit, respect his silence for a little while and so on. And is trying to regain control. In this situation, silence on your part shows respect and empathy for the client. Of course, so like not interrupt him by talking, asking him too much questions. If he's thinking, as example, if he has a problem or thinking about something, or he's trying to make a decision, silence may be a part because he's thinking. So don't interrupt him while he's thinking. But from time to time, like we say, you have to talk to the client and ask him, like, show that empathy, show kind of passionate in your client, in the relationship with your client. Ways to improve your communication skills, like know the person you are talking to, take notes of body languages, read your messages before sending, get to the point, record or watch yourself speaking. Remember that people do not care as much as you think. Be assertive, but keep it positive. With that, keep in mind that being silent is not the same as listening. Work on emotional awareness and management with your client. These are the points which you should be worried about when you deal with your client. So active listening. Active listening, as discussed, active listening means paying close attention to the client's verbal and non-verbal communication. You take care, your eyes on your client as a PSW. Your eyes should be on your client all time, listening to the contents, the intent, the feelings behind the words. Remember, non-verbal cues may reveal the client's true feeling. For example, we have an example here, like so as example, if someone tell you, I don't have pain today, but you notice that he's doing something, though he's saying he's not complaining of the pain, but he's still doing something like creasing or putting creams or whatever. He's telling you my knees is not paining, but he's still putting creams like for the like a Voltaren or whatever. Geez. That means if you watch, that means she's in pain and she's not telling you, or she's not telling you the truth, or denial of the pain. Like we said, one of the symptoms of the illnesses is the denial, maybe in this stage, denying to say that she or he is in pain. Active listening requires you to be interested in your client and to show that you care. The following are guidelines for active listening. So be always with the client. Active listening, essential communication skills for your career, confidence and feedback, and nonverbal communications, and open mindedness. Here are things which you have to say. Okay, so how can a PSW proceed or perform or conduct active listening? How can a PSW conduct active listening? First of all, you have to face the client. Your eyes on the client, and you face him, so that even he feel that you are interested in what you is saying to you, and he will feel that you are passionate with him or her. Make eye contact, of course. Without the eye contact, this person might think that you are disgracing him or something. So it's better to always keep on the eye contact. Third, lean towards the client. Usually, do not sit back with your arms crossed. No, crossed arms can be interpreted as an indication that you are not open to what the client is telling you. Respond to your clients. Once you hear from him something, you have to respond to him. However, sometimes your client just may not want to talk or may not respond to that. Avoid communication barriers also with your client. This is another point. And paraphrasing. Paraphrasing means that the client told me a sentence. I don't repeat it back like a parrot, but I will comprehend it, and based on this sentence, I will show. So as example, if the client is telling you, I am in pain today, I just need to massage my knees, or put cream for my knees, then you can say like this, okay, I will ask my supervisor or my nurse, the staff, to bring for you a Voltaren and to massage it with Voltaren, massage your knees with Voltaren. So here you didn't take exactly like the sentences exactly like he told you. No, you change it in these sentences, the nature of these sentences, and you return it back to him in a figure of paraphrasing. The paraphrasing is very important because it shows that you are interested in listening to your client, and you are not grandstanding. Grandstanding means talk more than you listen. No, as a PSW, you should listen more than you talk. It means both you and the sender knows that you understand the message. So this shows also the paraphrasing. Show also that you understand the message. It promotes further communication as well. Right. How to do the effective paraphrasing? Read and read understanding, put source away, write key points that you remember without looking at the source. So as example, he talked to me 3 sentences. I remember what he said. Accordingly, I will prepare the reply back, including parts, but not everything of these sentences which he told me. Let's say another example. I think I'm very hungry now. The patient is telling you, I think I'm very hungry now. I don't know, is it the time to eat or no? Then you will tell him, reply and tell him, yes, it's almost the time for dinner now. So the dinner will be served very quickly. Within about 10-15 minutes, dinner will be here. So you will not feel hungry anymore when you get the dinner. So in this case, you didn't say the same sentences which the client said exactly, but you comprehended the sentences which he said. You made an added to what he said, then you send it to him, reply him back accordingly. So here I see an example of paraphrasing, like as example. So this lady is saying, my mom irritates me. She picks on me for no reason at all. We do not like each other. Then he told her, so you are having problem getting along with your mom. That means he comprehend what she said because she was complaining about her relationship with her mom. So he said, you have a problem with your mom. That means that he listened to what she's saying and he changed in some words. But the event or the core event of her talk is still there. You are connected about your relationship with mom, was concerned about your relationship with her. Then she said, yes. Here is the paraphrasing. The sentence here is paraphrased in this blue square, is paraphrased here. Empathetic listening. Empathetic listening is kind of listening that shows that you are passionate towards your own client and that you are listening to him with empathy. Being open to trying to understand the experience and the feelings of the others. It involves acknowledgement, the other person's point of view without judging. Clients need to know that they are understood. Empathy can help reduce feelings of loneliness. When you listen to the others, as examples, they are complaining, the clients, your clients, you are a PSW, and your client is complaining from pain. So here, this makes him feel not lonely when you listen to him in empathetic listening. Empathetic means that you care while you are listening, or show signs of your face expression that you are, oh yes, oh my God, yeah, it's hurting, I know, and so on. So this is empathetic listening. Empathy can help reduce feelings of loneliness and sadness and can create bonds of trust between a support worker and the clients they support. So empathetic listening, listen empathetically means to listen with the intent to understand how the speakers feel, in addition to understanding his or her ideas. Show your empathy, oh my God, I'm sorry for to hear that. I know you are in pain. I hopefully this pain will go after leave and you will get better soon. So this we call it empathetic listening. Showing empathy involves identifying with the person's emotions and situation, even if not in agreement with them. Yeah, I know it hurts. I know it hurts. Yeah. But we have to to be very patient till it's relieved and heal up. Here, things needed for the empathetic listener. Empathetic listener must have some qualities like patience, mindfulness, self-awareness, trustworthy, wisdom, and non-judgment. Types of questions in the communication system. We have two types of questions. We have closed-end questions and open-end questions. Usually, in any type of communication, we have those two types of questions: closed-ended question and open-ended question. So the closed-ended question, the answers including yes or no. This is the closed-end questions. The open-ended question, including the feeling. Like as example, I will let the client talk about how far the pain is going on. How far his pain is, the pain. How far his pain. Is it severe or not severe or whatever? So I will let him talk, just talk. So this we call it open-ended question. Example, how do you feel now? I'm feeling better, I'm feeling bad, I'm just comme ci, comme ça. I feel if I turn it to the other, you guys posture me to the other side, I will be more better and so on. So we have two types of question, close-ended question and open-ended question. Finally, here are the differences between the closed question and open question. The closed questions is always the answer for the closed question is yes or no. Are you sad? Yes or no? Are you satisfied with the plan? Yes, I'm satisfied. No, I'm not satisfied. It's only one word, yes or no. Is this fine with you? This works with you? Okay. Yes, okay. No. Do you know normally do butter? Yes or no? You normally brush your teeth before you sleep? Yes or no? You normally smoke after the lunch? Yes or no? You normally take your prescriptions before the dinner? Yes or no? Do you like this? Yes or no? Do you have a hard time? Yes or no? So these are examples for closed questions. But open questions, when you want the client or the patient as a PSW to describe to you something or situation. How was your sleeping today? So he will tell you, I slept very well. I had 8 hours of sleeping. I was just very excited about things before I sleep, but sleeping relieved me from it, and so on. How satisfied or dissatisfied with the pain? How far the pain is going on? What do you think about this? How do you normally, how, like you see here now, we put how, what, which was not here. Would you like anything changed about this? How will carry you? So see here, the words how, the words what, and those words also comes here to be experienced. That's what here I have now for the moment for the differences between the closed and open questions. I will go now to ask a question before we end this part and say PSW must concern with the right communication with his clients or patients. Then comment. You will comment in this sentence. So that means you will talk about the things which we'll talk about now, starting from passionate listening and so on, and how to improve your communication skills with your clients. Also, how to be active listener that you will add. You have to be passionate. You have to give the clients the confidence. You have to listen to them, active listening. Also, things like facing the client, making eye contact, lean towards the client. Do not cross your hands. Do not cross your legs. Do not sit like looking to the client with half an eye. No. Respond to your client seriously. Give him a feeling that you are responding to what he said. Avoid communication barriers like talking and there is distortion or there is noise or whatever. No. Try to finish this noise and this distortion and don't work it. Always also paraphrase when you are talking with your client. You have to paraphrase. Don't take the sentence exactly like the parrot and repeat it back as it is. No. Comprehend the sentences and find an answers also for that sentences and show the client that you are following him and that you comprehend what he's saying, but you don't repeat back what the client said. Don't repeat it as a parrot. No. How to paraphrase, and then we said also this is an example for paraphrasing and the empathetic listening. We said a PSW must have empathetic listening to show the care and show the interest in your clients and act accordingly. And then finally, we said that as a PSW, you have two types of question and you have to conduct both of them. Two types of questions, close-ended question and open-end question, close-ended and open-ended question. And both of them is very important as a method of communication and dealing with your clients. Finally, we came here to the question, and I will stop here like around 5 minutes for you guys to get your answers. And you just answer in your inside your notebook. We don't need it here. I just want you to get aware of the main points which we talk about the part of the communication today. Thank you. I will wait here about 5 minutes before we move to the next part.